Hi, everyone. This is Dr. Swami Venuturupalli. Welcome to this live webcast. I'm the chair of the Medical Advisory Committee of Lupus LA, and I thank you for the opportunity of inviting me to share my thoughts and my opinions about what's going on. Wow, it's been a crazy week, as all of you know. The shelves are empty of groceries. People are panicking. I'm getting questions up the wazoo. People are asking me all kinds of things like, what do I do? Am I at increased risk? Can I get Plaquenil? That's been a huge question for me. So all of these things are happening right now where our situation is evolving rapidly. I'm completely keeping up to date on what's going on with the whole COVID-19 situation, and I'm here today to share my expertise with you. Thank you, all of you who have submitted these questions, and thank you for joining us. I have a list of questions that were submitted earlier, and I'm going to read off some of them. Huge one came from Tony Braxton, who's on our board of Lupus LA. Shout out to Tony if you're in here. She wanted to know that, hey, if we're already on Plaquenil, can that prevent COVID-19 in us? So let me tell you a little bit about Plaquenil. So Plaquenil, as you all know, it has been around forever. It's a anti-malaria medication that has been used for rheumatoid arthritis and lupus since the 1960s. The way that Plaquenil works is it connects to something known as toll-like receptors. Toll-like receptors are on immune sensing cells, part of the innate immune system. And their job of these toll-like receptors is to sense viral particles. So viruses attach to these toll-like receptors and then try to take over the immune system. Plaquenil blocks these toll-like receptors. The reason that it works in lupus is that autoantigens, those are self-antigens, also stimulate the toll-like receptors. So Plaquenil, by blocking them, potentially stops the immune activation in a disease like lupus. However, in a disease state like coronavirus, maybe there is a benefit by using Plaquenil blocking toll-like receptors. Now, the operative word here is maybe. So I really need everyone to look at this data that based on which this recommendation is being made. Firstly, it comes from China in Wuhan, where the government published a report stating that patients who had active COVID virus infection were treated with chloroquine, which is a cousin of Plaquenil, if you may. It's in the same class of drugs, and that was effective and helped. So based on that, several groups started experimenting with chloroquine and then Plaquenil by extension. So we started using these in our sickest patients. So far, we don't know if it's really helping or not. We think it's helping, but we don't know. A clinical trial is already underway to answer this very question, to know whether or not we can benefit from Plaquenil. So this run on Plaquenil that I'm seeing, I think is a little premature. Right now, I think where Plaquenil really has a role to play is in patients who are hospitalized from the coronavirus. And that's a big reason to use Plaquenil, not in the general population. So that's my thing about Plaquenil. The other piece of information I want to give you guys is about the coronavirus itself. And the question a patient asked me today was, am I going to get the coronavirus? And if so, am I going to die because I have lupus? And that's a common question, and that's a very valid question. One would think that everybody is going to die with coronavirus based on the panic that I'm seeing out there on the streets. I mean, but that's not the case. That's not what's happening with coronavirus. Coronavirus is a family of viruses that include even viruses like the common cold. This particular virus, the SARS-CoV-2 virus, which is known as the COVID-19 virus, happens to be more virulent than most of the other coronaviruses. We think that it emerged from bats and then got into humans. And because we've never seen it as a human species, that's why it's so severe. Once people get immunity to the virus, then they seem to remain immune over a period of time. So overall, it's not the most virulent virus. For example, if somebody got Ebola, I'd be very scared for them personally. If you get coronavirus, I think the data on this is that most people have a mild illness, 80% or so. 10 to 15% don't have a mild illness, they have a fairly severe illness. They get short of breath, they might have fevers, they might feel sick for a while, and some of them need to be in the hospital. And 5% of people actually get a bad infection requiring hospitalization, possibly they get a pneumonia, they possibly need to be on a ventilator. All kinds of data going on out there. People say that, oh, if you're on a ventilator, then I have a 50+% chance of dying. I don't think that's true. I think that all needs to be taken into context of the healthcare system's ability to deal with the patients who are getting sick and coming to the hospital. By now, each and every one of you has seen the whole thing about the curve and flattening the curve and things like that. I think that's really critical and it's important, because the reason people die from coronavirus is not because the coronavirus is deadly or horrible or the worst virus we've ever seen. By far, it's not, believe me. We've seen some horrible viruses and other infections that can really kill people. This is not one of them. But what's happening is that you do need high levels of oxygen going into the lungs in order to get over this virus. Now, if you don't have a hospital bed which can allow a patient to get a high level of oxygen, then what happens? That patient doesn't get oxygen and then they might actually die. The only situation that that's going to happen in the United States is if the whole system has too many patients and there aren't enough hospital beds. That's why I'm such a fan of all these measures that have been put together for social distancing. Those of you who have been following us on Attune Health, and we have a YouTube channel where I just posted a talk, and I posted talks the week before and the week before, tracking this whole thing and trying to give some reassurance to people about all the things that I'm saying. Please take a look at that stuff. It's on Attune Health. We're on Twitter, Instagram, Facebook, and whatever else you can think of. We're on there. So what I would say is that this is not the world's worst virus. We're pretty much all going to end up getting it, 60 to 70% of the population. But if all of us get it right now, then our healthcare system is not going to be able to keep up with the 10 to 15% of people who actually need the hospitalization and the high levels of oxygen in order to recover. And that's when our mortality rates are going to go high. So the context of this needs to be the data from Wuhan, which was the initial place of the virus, is that about 3% of people actually died from the virus. Now, the rest of China, only 0.7% of people died from the virus. Now, in South Korea, which is doing an outstanding job and actually stopped the virus from entering its country, and so with active surveillance and doing about 10,000 tests every day, their mortality rate is even lower. And so what I'm trying to really emphasize here is that this is not the world's worst virus, okay? It's an easily transmittable virus. If one person has it, without social distancing, about 4 people or so will get it. With social distancing, they may infect maybe one other person and it might be slow. We could slow this down and then we can actually win this battle. So today's video that I recorded, it's on our YouTube channel again, and we'll tweet it out for those of you who want it. Lupus LA said that they will tweet it out after this talk. Again, this data is now emerging in the United States. I think we have a fighting chance really of beating this. Now, some of the questions that we're getting from you all is, I have lupus, so am I at increased risk? Yes, you are at an increased risk for 2 reasons. One is if you're on an immunosuppressive medicine, then any virus can cause a lot of havoc. So one has to be careful if you have lupus. You have to inform people around you that you have lupus and that you're immunosuppressed. So that immediately puts you into the high-risk categories. Now, the other reason why lupus potentially could be a problem is that the immune system is not healthy in lupus. First of all, it's not reacting the right way. It's reacting to autoantigens. So a disordered immune system, could it be more susceptible to coronavirus? So what data do we have to know whether that's a fact or not? The data that we really have is from China and the Wuhan province, and that's the best data that we have so far. And we also had a recent study, I just reviewed it before the talk right now, which showed that in Washington State, out of 21 people who were in the ICU requiring ventilation. Ventilation is when you put a tube down someone's throat and put high levels of oxygen into the lungs. Immunosuppression and autoimmune diseases were some of the risk factors involved. They weren't the super high risk categories. The other conditions that put you at a higher risk to require mechanical ventilation are: one is age, two is underlying lung disease. So if you have COPD, you were a smoker, if you have had pneumonias, if you are having pulmonary hypertension, for example, or interstitial lung disease, that puts you at a higher risk. The third and interesting higher risk category is anybody with pre-existing cardiac disease. It turns out that the coronavirus receptors are present not only in the lung tissue. By the way, they're not present in the nasal tissue, they're present in the lung tissue, they're present in the gut tissue, and also in the cardiac tissue. So there might be a correlation between patients with pre-existing cardiac disease getting coronavirus and having a slightly higher mortality rate. So those are all things that we have to keep at the back of our minds as we move forward. So I think that's kind of my talk on this, and I'm going to look at some of the questions that you all have been submitting. Thank you again for being on this live chat, and I'm happy to look at some of your questions that are being submitted to me by Lupus LA. So let's take a look. Firstly, tons of questions on Plaquenil. There's this crazy run on Plaquenil, and I'm hearing from my local pharmacists that they're concerned that their supplies might run out. I think that's something that lupus patients should actually, who are already on Plaquenil, should talk to their pharmacists and make sure that they have enough of a supply, because there's this crazy panic out there to get Plaquenil and load up on it as though it's some sort of a panacea against this very mild virus, which I think is completely out of proportion to reality. So I would say that if you're a lupus patient on Plaquenil, can it protect you? We don't have data for that, so I can't directly answer that question. If someone pushes me and says, take a guess, will it protect you? I would say, yeah, possibly, but I can't be sure about that. I'm certainly not recommending it as prophylaxis, or if somebody is not on Plaquenil, don't worry, you're not missing out on something big, really, I mean it. So that's one question that's been coming up. What about Plaquenil and lupus drugs? Now, other lupus drugs like Cellcept and cytokine, of course, Rituxan, etc., can suppress your immune system. That can put you at a higher risk for getting bad complications from coronavirus. So you do need to take extra precautions if you are in one of those categories. So let me look at more questions. Again, more Plaquenil questions. I'm unable to get Plaquenil at any pharmacy. Where can I get it? I don't have a great answer for you. I'm so hopeful that the drug companies start manufacturing this in bulk. I'm hoping that compounding pharmacies can get a hold of the chemical and can compound it. But Bayer, a German company, just said that they're going to manufacture millions of tons of it. So I'm hopeful that this is a short-term panic buying moment that will all stop and allow the doctors to do their job, which is basically to use Plaquenil in patients who are really sick and who really need this. And if they're in the hospital and if we feel like we need to treat them with it, we should be able to have access to it. So I don't have a great answer for that question, but those would be my suggestions. Now, someone asked a question about Rituxan, and I think I answered that. You are at a slightly higher risk of Rituxan. Now, when we talk about missing a dose of a drug, that's something that we should take very seriously, because it's more likely, honestly, that you will have problems from complications of lupus if you miss your drug than from the coronavirus. It's more likely right now. If I was to advise each and every one of you, I would say, listen, give the healthcare system a minute to figure out our protocols, to figure out what we're doing with our patients. Give us a minute to try and understand this disease so that we can start curing it. I'm very hopeful that we'll have pharmacological therapies very quickly. First step in beating this coronavirus epidemic, number one, we need to get rapid testing available. And that's been a work in progress. We've had some stumbles, but I'm hoping over the next week or two, we'll rapidly be able to test everyone so we'll know who's safe to be at work, who's not, etc. That's step one. Step two in beating this epidemic is to have drugs. And we actually have a lot of candidate drugs. Remdesivir is a antiviral medication that's being used in the patients who are really sick on a compassionate basis. Again, don't make a run for it. I can't prescribe it to you. Nobody can prescribe it to you. It's only used on a compassionate basis. Or one of the antiretroviral medications, Kaletra, for example, is also being looked at very carefully. Now, one interesting fact about coronavirus is that some people, not everyone, some people get really, really sick around day 8 or 9. And the reason for that is that the immune system starts attacking the coronavirus, and actually the immune system response is way over the top for what needs to be done to control this virus. And that's a condition known as cytokine storm. In fact, one of your viewers actually asked this question. So what is a cytokine storm? Cytokines basically is a fancy word for chemicals secreted by immune cells. And cytokines have wide-ranging effects and biological effects. They signal to other cells to get involved. They rally the troops of the immune system to attack all the virus particles. But when there's a cytokine storm, the normal stops and the normal checks and balances that the immune system has inbuilt are not working. So all these cytokines are just pouring out, and that causes a ton of inflammation. Inflammation then inflames the lungs, the heart, and everything around. And this then causes us to lose control of this immune response. And this immune response itself can lead to some patients becoming really critically ill. Now, the good news about this is that we, as rheumatologists, know how to treat cytokine storm, or at least know how to control it. It's not an easy thing to control, I will admit, but we have some drugs that we are aware of that we can use in those situations. Again, don't run to your local drugstore and ask for these drugs because they need to be reserved for medical professionals to get a hold of them. So that's about cytokine storm. So where the thought I was trying to express before this was holding your lupus medications because your fear of coronavirus. So drugs that are critical. For example, if you have lupus nephritis that needs to be treated, you're more likely to have long-term health problems, etc., from missing your drugs than from dying from coronavirus. Now, if you're really, really afraid, I think give us a few minutes. By that I mean a few weeks to really figure out our protocols, to understand what the data is coming in. And we're doing this. I'm very happy to inform all of you that there's a global rheumatological association that has formed an alliance called the COVID-19 Task Force, which I'm part of. And we've all organized ourselves and we're sharing data. It's amazing to see such great collaboration occur over the period of a week. We're organized, we're sharing articles, we're sharing resources, we're sharing our local protocols, we're talking to each other, we're really trying to solve this. We're also creating a registry. So any one of our patients who gets affected that we are aware of, we're putting them into a registry so we can learn and see how the immune system is reacting, so we can disseminate this knowledge rapidly across the world. I really feel that we have a great shot at beating this virus. Again, sorry, I keep getting distracted, but I need to finish this comment about the drug holding. I'm not a big fan of holding the drugs right now based on all the knowledge that I have and what I'm seeing. Obviously, we may change our opinions down the road, but right now I would say I think that continuing the drugs is okay. Benlysta, for example, is not a huge immunosuppressor in my opinion. So if you're doing well and everything's stable, and if you want to postpone your Benlysta, I think that might be a reasonable decision. Again, I'm not recommending it. This has to be a talk between you and your rheumatologist or other physicians taking care of you. Let me go on to another question. So how much of a higher risk are we as lupus patients? I don't know if we have good data to answer that question. I think if you're immunosuppressed, you're at higher risk. That has been established. lupus and autoimmune disease per se, data needs to be looked at. We just saw one paper from Washington State that said that yes, patients with immunosuppression and patients with autoimmune disease were more likely to be in critical care, but that didn't change the mortality or anything of that sort. Let me see. Next question is, could coronavirus be spread by food, by droplets or body fluids? Great question. Let me explain to you. Coronavirus, luckily for us, is not spread in the air. So if you go into a room and somebody else has coronavirus, unlikely that you're going to get it from that. It really is from droplets. What are droplets? Droplets are mucus-containing secretions which are emitted from the body by a person who's infected. And those secretions then live on surfaces. And there's data suggesting that this coronavirus can live anywhere from 2 to 12 hours, in some cases even more, on certain types of surfaces. And what then happens is that you might inadvertently touch that surface and then touch your face, and that's how you catch the infection. We're about 99% certain of this. However, we're not 100% certain because this is a new and evolving situation. But I think 99 is pretty good. And so what that means is that you shouldn't panic just because you're in the room with somebody else who might have been exposed to someone's girlfriend who was finally diagnosed with COVID-19. Those are low-risk exposures. What we like to do is we like to classify exposure risk based on low, medium, and high. So the highest risk exposures are healthcare workers who are actively putting their gloves into people's mouths and trying to put a tube down their throat, etc. That generates a ton of aerosols into the air, which then can infect a healthcare worker. So we need those masks for those healthcare workers, the N95s that people are holding on to. We need them in the hospital. I'm just getting a memo from my local hospital saying that we have a severe shortage of those masks. So if anyone has them, I urge you to donate them to your local hospital. The healthcare workers are going to need them. I really don't want to lose my colleagues in this battle. That gets me a little upset when I think about it. The other types of exposure are medium risk exposures. And that's when you have a prolonged contact, usually a family member, and you're sitting with them for hours, you're sharing plates and you're sharing, household items. That's, a moderate risk exposure and should be taken very seriously and lead to self-quarantining of both parties. Low risk exposure is somebody that you've maybe been in contact with who was asymptomatic and may have been shedding some of the virus, but you didn't really exchange handshakes, or you didn't touch or peck on the face or anything of that sort. So that's a low risk exposure in my opinion at this time. Okay, let's go to the next question. Will reducing my immunosuppressants right now help me fight this virus? It's controversial. If the immune system is not healthy, yes, there is an increased risk. But that needs to be weighed against stopping the immunosuppressive and what effects that can have on your overall health. And, as you all know, lupus can be very, very devastating to a person. And the last thing you want to do is have a lupus flare and need to go to the hospital right now, because then you'll catch coronavirus, possibly, if you do that. So I would say that this needs to be a discussion between you and your provider and make some adjustments based on your discussion, if your provider feels it's safe to do it. All right. So one other question is, so we talked about Plaquenil, we talked about COVID-19 and lupus. Can someone have COVID-19 for longer than 2 weeks and not know it? Unfortunately, it's possible. Based on the data that we're seeing, it's possible somebody could have it. But remember, the COVID-19 symptoms, they're not your sniffles. They're not your upper respiratory stuff, not the sore throat. Fevers, cough, shortness of breath. Those are the three big ones. Now, GI symptoms is also getting some attention and coming up on the list. But those are your main symptoms that you really need to worry about. And so answering the question, for people can shed the virus for more than 2 weeks. We've seen studies on that. However, whether they're infective after 2 weeks or not has not been shown. So whether you're still shedding the RNA but it's no longer infective is a very likely possibility. But usually 2 weeks right now, the medical and scientific community has a consensus that 2 weeks generally allows most people, 99+% of people, to clear the virus effectively from their system. And let me see, more questions. Am I at risk if I've been in remission for 10 years? Less likely. Active disease, immunosuppression from lupus is more likely. Vitamin C and supplements, vitamin C, zinc, and other supplements are being touted, up the wazoo in all your lay publication. I see no harm to it, honestly, but I'm personally not taking vitamin C or zinc because it's a great promise that never occurred. Linus Pauling in the 70s used to take 10,000 units every day and take 10 times that and mega dose of vitamin C, and they claimed that it could cure cancer and never did. It never cured lupus. So I think glutathione, which is an antioxidant, may be helpful. But again, these things are anecdotal. We don't know from a real scientific manner whether they're effective or not. But if you want to take vitamin C and zinc, sure, I have no objection to that at all. Anything to keep your immune system healthy is good. More important, in my opinion, to keep your immune system healthy, you need to keep your stress down. Really. I think that is so important. We have tons of studies in lupus literature showing that stress is a trigger for lupus. I know these are stressful times. Believe me, I'm stressed too. But I also take some time to take care of myself a little bit. That's important. I would love for each and every one of you to practice that. The other things are eating healthy, getting enough sleep, etc. That keeps your immune system really healthy. Do masks, particularly N95, protect against the virus? Yes, they do. Okay, so there's a lot of misinformation here. The guidelines from the CDC are they're not recommending most people to wear masks because they will be in a low risk exposure situation. These masks are really for doctors who are doing the high risk procedures, doctors, nurses, respiratory therapists, etc., who are doing the high risk procedures. Wearing an N95 mask is very uncomfortable. I hate it. When I have to wear one, I try to get it off, get out of the room, get it off as soon as I can. So wear it. The second thing is the fit has to be right for it to work. So you need to actually be fitted professionally for it to really work. And the third thing is that the regular surgical masks that you see people wearing out in the grocery store, they're also not that comfortable. So people actually, there's studies showing that you keep touching your face because you're uncomfortable, and actually that's what spreads the virus after you've touched something on the grocery store and then touch your face to adjust the mask. So overall, they've not shown benefit to protect you from getting this virus infection. What they do help with, and I do think that if you have symptoms, if you're shedding, if you're known to have coronavirus and you don't want to infect other people, or if you're coughing and you're not sure, you don't want to infect other people, you wear a mask. That way all of your secretions stay within you and don't go to the outside world, and you don't spread your germs. So that's the way to use masks, in my opinion, for the general public. Cytokine syndrome and COVID-19, I think I covered that. And then going outside, going to work, and food delivery are other questions that we have. Myself, my family, and friends have lupus. Should we stay in the house? Honestly, at this point in time, as you know, in California, we have an order from the governor suggesting that most people, other than essential services, should stay home. And the reason for that is our healthcare system needs some time to develop a plan to combat this virus. If everyone's out and about, we will get overwhelmed with the number of cases. So please do your part. That is important. Everybody needs to do it, not just lupus patients. Lupus patients on immunosuppression are at higher risk, and they should actually be extremely diligent about this, and they should not be out and about too much, probably more so than the general public. Is it safe to order food from restaurants, pickup, and delivery? At the moment, we are continuing these services. Obviously, food handling, hygiene is important. So if that's not being practiced, then the things, the utensil that you're touching and the plates, etc., that you're touching are cold. food is cold, then all of these factors need to be taken into account. If there's a sick employee in a restaurant, for example, you could contract COVID-19 from them. So again, minimize this as much as possible. Hand washing, oh my God, it's so important. It is so important. You can see my hands are pretty chapped from, I used to wash my hands 20 times a day, and now I think it's like 40 times a day or something, because hands are completely chapped from hand washing. But, I need to do it. We're all going to need to do it. So please do it. I work at a gas station. Should I still be working, is the question. Good question. I think, no right answer. You have to apply your risk of contracting it with your current medical situation. If you have active lupus, if you're immunosuppressed, I would say you should probably be working from home if you can. Those would be my words of advice to you. And I think those are some of the questions that I have seen here. It's 2:30, and I would, maybe see if there's a couple more questions, or on this thread, if anyone has something urgent that you want me to look at, just put it on here, something that I didn't answer. Somebody said that they were at an urgent care, didn't get a mask. I mean, I have to tell you, there is a shortage of masks. I mean, doctors' offices, our own office, for example, has very few masks for our patients and our employees. As a result of that, we have actually cut down our traffic in our clinic, and we've moved to telemedicine appointments as much as possible until the situation stabilizes. So I think the mask situation is just so crazy, and I wish that situation gets resolved quickly. But again, as I said, for the general public, you don't need masks. And someone said that they're pregnant and very, very nervous. So good news on that front from Wuhan, China, where there was data that some people, they followed people who were pregnant, and the pregnancy was okay. The kids came out okay. This wasn't like the Zika virus, which was affecting the babies. And actually, the pregnancy-related people did not have more complications than other people. So that's some good news there. And somebody asked about natural steps and vitamins. I think I covered that. So outside of stress reduction, what else can be done to help the immune system? So this is really anecdotal. We don't have all the data and the science behind us to be very confident about these recommendations. But me personally, I think that there is a very strong connection between overall health, particularly your gut health and your respiratory health and your oral hygiene, and how autoimmune diseases behave. And I think it's really important to work on all of those aspects. I think it's beyond the scope of this particular presentation to discuss this in more detail, other than telling you that these areas of health are so important for your immune system health, in my opinion. Things that help, obviously, are anti-inflammatory diets. I'm a big, big proponent of them. I'm a big proponent of movement therapy, mindfulness, and meditation. I think those are huge areas that people can work on to improve their immune system's health. So looking through some more questions before signing off. How can you tell the difference between chronic pericarditis and chest pain that's from COVID-19? Those are really hard questions to answer. It requires a medical professional to listen in and kind of help you differentiate, I would say. You'll have to talk to your doctors. So one question is about taking boosting supplements, and people are saying they've been advised by their doctors because they have lupus not to take immune boosting supplements. I actually do fall in that camp of doctors, because I have seen personally some patients who've started taking a lot of immune boosting supplements, and they can get active lupus flares. Now, some of these are anecdotal reports. I don't have great science behind this, but in general, I think immune boosting supplements and lupus are not a great combination, but it's more out of um, lack of having science to back this up and just fear that people will have complications that I say this. So somebody mentioned that they're a nurse in the community. Victoria Mendes, shout out to you. I like that. Um, keep up the good work. You have a history of lupus, MMF treatment, cutback for now. What are your suggestions? Personal protective equipment, if you can get your hands on it, because you're going into people's homes, you might be exposed to people um, who are infected. What you need is a droplet infection. If people are actively coughing, give them a mask right away so that they don't infect you with the germ. You have to glove up for each patient. You have to have a gown so that your clothes don't get infected. And if they do, you need to immediately get them out and wash them. Soap, water, hand washing, washing clothes that have been affected. These are all very effective techniques. So there's nothing magical about this virus. I mean, um, this is not your end of the world contagion movie type of virus, in my opinion. I think this is controllable. I think we can get ahead of it. I think we all need to take a pause. We need to take a deep breath, and we need to um, figure this out together, work together as a community. That's how we're going to beat this. So with that, I'm going to call it. And if you have more questions, please communicate with us on social media. At Lupus LA, we have some amazing people working there. Shout out to them for all the amazing work that you're doing. Great board of directors. Shout out to Tony Braxton for being here, supporting us all the way. And real shout out to you, the lupus community, for organizing, being here, helping each other out, talking to us, telling us about your concerns, and for just being great people. So thank you again for the opportunity. This is Dr. Swami Venturupalli from Attune Health, and I'm signing off. Thanks.